Hello, I'm Michael Pierce, and this is The Human Condition. Today our topic is health screening for mental health issues, lab tests that you can do for mental health issues, and some of the links between what these lab tests reveal and what your brain may be screaming for and needing. My first test is hair metals. I like to test for hair metals, and that shows me if there's heavy metals like aluminum and mercury and lead and cadmium and stuff that should not be in your body, except in small amounts. And the reason for that is it's in the natural environment. We have volcanoes, we have Earth's crust, and we have small amounts of heavy metals that are in the environment naturally without man and human activity. And so that's something that we have to deal with, and we purge it out of our body all the time. So there is a little bit of background noise of amounts of heavy metals that we all have to get rid of. And so that's normal to have a certain normal amount, but not an excessive amount or a very, very, very small amount, which may also indicate a problem of clearing heavy metals. We'll talk about that on another video. Sometimes I will also do a test of both urine and stool for heavy metals. And the reason for that is, while that's not a very good measure of chronic exposure, because it only tells you a few hours or at most a couple days of clearance through those organs, I want to see them because I want to see how well a person's clearing heavy metals from those organs. I want to see if they're clearing a massive amount, which may be too much, and they're clearing too fast, or I want to see if they're not clearing through one of those routes. Like, for example, maybe they're clearing nicely and heavy metals are coming out of their stool, but there isn't any heavy metals coming out of their urine. I want to figure out why and understand why they're not detoxifying through both pathways. I also like to look at blood, and my favorite thing for mental health is insulin resistance. I think the most screaming need for Americans that have problems with mental health and that are poor responders to either neurofeedback or drug therapies from their psychiatrist or from counseling and other methods with their counselors is insulin resistance. It's a huge problem among Americans. So we've got to measure fasting glucose and fasting insulin and hemoglobin A1C, and there's a bunch of other markers we can measure, but those are the big ones, and those are the ones we look for to see if a person might be having insulin resistance. If you're having a problem with insulin resistance, your brain is not going to function right, and you're going to have trouble, and no amount of counseling is going to fix that. We call that organic brain disorders and organic brain dysfunction. Now, all the textbooks that talk about diagnosing mental illness describe the fact that you can have a criteria for a mental illness, whatever it is, and you may meet it, but it always has a disclaimer at the end of each diagnostic category in the whole book, the DSM, the Diagnostic and Statistical Manual, whichever edition, and it will say this illness, like depression or anxiety, except in the case of another cause like hypothyroidism or like a gunshot wound or like an infection or like anemia, right? These are things that are metabolic that have to do with your body chemistry that could affect your mental health. So if you are feverish and you're delirious from fever, you may not want to diagnose that person's symptoms as having anxiety or depression because they've got a fever. So they may be delirious. You don't want to let the mental health criteria be diagnosed and be used when you haven't screened for all these other things. So what else can you screen for? You can screen for dysbiosis. There's a couple ways to do that. Dysbiosis is messed up balance of bacteria, the normal healthy ones in bacteria and fungi and viruses and all the natural stuff that lives in your gut. That balance of healthy organisms can be checked by either looking at the stool or by looking at the urine. And when we look at the urine, we're looking at organic acids, and those tell us the breakdown products of those little bugs, and the stool test shows the actual bugs themselves. So we're looking for dysbiosis to see if there's an imbalance. We can also look at the bile and the gallbladder. We can look for signs in blood work. Now there's a number of these things, and they have to do with bilirubin and creatinine phosphokinase, CPK. They have to do with your alkaline phosphatase enzyme. So these are things in blood that we can look for that might tell us that there's a problem with the gallbladder. If there's a problem with the gallbladder and the liver and the pancreas producing bile, the person may have real trouble with their brain because bile is a neurotransmitter. In fact, there's many molecules from bile salts that become neurotransmitters when they cross into the blood-brain barrier. That doesn't mean they're dopamine and serotonin. It means their own neurotransmitters that do other things, and it's very fascinating. Another thing that's really important for brain health is a lipid panel. A blood test of the lipids, which would be, say, total cholesterol, LDL, HDL, triglycerides, triglycerides, this kind of stuff is what we're looking for when we're measuring. People that have a low cholesterol, a lot of times if their cholesterol is below 140, they might have some real problems with their mentation. They might have some real problems using their brain, and that means mood regulation and emotion regulation. That means thinking and cognition. That means the ability to sleep and regulate their emotions and their autonomic nervous system, panic attacks. So it's important to know that while we don't like to have heart disease and plaque in our arteries, low cholesterol may be a bigger problem for the brain than high cholesterol. Certainly if a person has high LDL, the low density lipoprotein, which is called often the bad cholesterol, and it really isn't. We have to know that LDL is almost always high in our population that have carnivore diet or a low carb diet or a ketogenic diet. And it's okay to have an LDL that's a little bit high, but usually HDL is normal and total cholesterol may be a little high, and triglycerides should be spot on normal. If triglycerides are high, we've got a real problem. And GGT should be looked at because that'll show common bile duct inflammation and irritation. That's called gamma glutamyltransferase. It's another enzyme that can be tested for. It's not always on a panel, so you have to ask your doctor for GGT because it's not automatically included. Some of these are automatically included and some of these are not, and you have to ask your doctor for them. Another thing that we would look at is a thyroid panel. It's very useful to have a thyroid panel that would look at things like total T3 and total T4 and free T3 and free T4, TSH, also the thyroid antibodies, and there are some other things we can look for too, like resin T3 uptake and reverse T3. Those are a couple of things that tell us a lot about your thyroid and how your thyroid is doing. If you do those tests, it might show that you've got a thyroid imbalance, and it's not your brain. It's your brain responding to an imbalanced thyroid. So consider a thyroid panel for your blood. Another thing that can happen to the brain in mental health issues, and this is a long laundry list, isn't it, is the antibodies. A person can have an immune problem that affects their brain. And so one of the first things that we like to do is test for total antibodies in blood. So we order a test for all the antibodies and look for how many IgA and IgM and IgG and IgE, which are 4 types of antibodies, A, G, E, and M, are present. And so that's not measuring specific antibodies like antibodies to potato or antibodies to celery or antibodies to dust or dander or your cerebellum or to some chemical or some lectin, but it's total antibodies of each class. So it's very important to measure that and find out if a person has an imbalance in their immune system, and that may begin to show a doctor that they've got a problem with their immune system. And that would lead down the road of more specific antibody testing, auto or self-antibody testing, environmental antigen testing like airborne antigens, food antibody testing of at least the 4 types we talked about, and many times it would lead to other immune testing that I'm not going to go into today, but there's a bunch of other immune testing that I'll talk about in my course section on our website, where I really go through and I handhold and spoon feed you through those processes and help you understand just what are those tests, what are their names, what do they measure, and what do they show, how does it work, and how does it affect your brain. Probably the most famous metabolic and longest known metabolic interaction with the brain is the liver encephalopathy. And so a person can get basically a brain inflammation caused by a liver disease. And that is something that shows up very clearly on EEG, brainwave scans. And so we see things like big old triphasic waves, which are these big giant waves that show up throughout the brain, and they're very large and they're got 3 phases to them and they show up. And there are also some other types of things that show metabolic encephalopathy in general, and they don't tell you necessarily whether it's the liver or whether it's maybe a poisoning or a heavy metal toxicity or a pesticide exposure, or you're having a diabetic shock, or you're having massively low blood sugar. Any metabolic disorder or even an electrolyte imbalance can manifest as a brainwave change that looks like encephalopathy. And usually that looks like slow waves that are spread throughout the brain with pretty much rhythmicity and disorganization, and they're spread throughout the brain and they're very slow waves and they're all over the brain. And those are theta and delta waves. And that's a general idea of what encephalopathy looks like. You want to consider having a screening for that, and you'd be surprised how many people are walking around and we do a brain scan measuring their brain waves and we discover that they've got metabolic encephalopathy and they're walking around with it on board and they don't know it. Now, many people with encephalopathy are obtunded and they're not with it. They're unconscious or they're semi-conscious or they're really out of it and they're not aware and they're in a hospital. But you can have an encephalopathy and be ambulatory and be walking around and conversational, but you feel pretty crappy when you have it. The brainwave EEG test shows that there could be a non-disclosed encephalopathy, and it would steer the doctor toward testing different things and trying to figure out through physical exam and history taking and blood work and other lab tests what system is failing and what system is causing that brain to have an encephalopathy. And so you wouldn't do neurofeedback on that brain. You would try to fix the metabolic underlying problem first, the diabetes, the uncontrolled hypothyroid, the thyroid storm, whatever it is. I also really like the CT cardiac calcium score. So this is where the patient gets into a scanner, a CT scan, which is a CAT scan, and that's an X-ray machine, right? It's an X-ray machine that's shaped like an MRI machine, only it uses radiation, X-rays. It spins around just like an MRI machine, but it's a lot faster. And usually what it does is it takes pictures all around your heart and your blood vessels and shows you what your calcium score is in the plaques around your heart. And that infers how bad your plaquing might be in the small vessels of your brain and in your toes and in all over your body. That's a very useful test, and I would refer you to Ivor Cummins, the Fat Emperor, and his channel, because he talks a great deal about this, and I think he does a better job than I do. I certainly will go more into this in my courses and in my groups on our new website. When you look at other screenings for mental health issues, there is a test that I like, and I'm not a big fan of gadolinium as a holistic doctor. Gadolinium is used in MRI contrast to look at things like cancer and other types of problems that are more acutely medical in the brain. I don't want to say that we should never use gadolinium, because that would be medically irresponsible. The idea is that when we use gadolinium, we're looking for something very serious and very medical, like a bleed or a tumor or some kind of malformation, and the gadolinium helps show that very clearly on an MRI. But for most of the holistic purposes that we're doing with people where they've got chronic mental illnesses, chronic problems, chronic concussions, I would prefer to use a higher magnet, meaning a more powerful magnet, and not the contrast gadolinium. And so that usually, in that case, I tend to order a 3 Tesla MRI, because most of the MRIs that you would get exposed to in the world today are 1 or 1.5 Tesla magnets. And I would order a 3 Tesla magnet, and in some cases there are 7 Tesla magnets, which are much more powerful, and they give a much higher resolution, and they can show better what's going on in the brain. And they also will allow you to ask for DTI, or diffusion tensor imaging. Diffusion tensor imaging shows you how intact are the white matter highways that carry messages along the brain. Not just the gray matter where you process stuff, but the white matter where you send stuff. That's the highways of the brain. So 3 Tesla MRI without contrast, without gadolinium, and with DTI added on for help with chronic and acute concussions and chronic metabolic problems and brain problems. I also like SPECT scan of the brain, which is a CT scan of the brain. I talked earlier about a SPECT or CT scan of the heart, but now I'm talking about a CT scan of the brain. That's also very, very useful. And then lastly, I'll mention that there's a whole bunch of urine tests that are useful for measuring mental health issues that affect the brain. And those would be the standard urine analysis, which is the UA you'd get when you go to a GP, general practice medical doctor. And that would just be where you pee in a cup. They run it for proteins and for ketones and for casts from your kidneys. They're looking for pH, they're looking for blood in the urine, they're looking for sugar in the urine, all this stuff, protein in the urine. That's very useful to see if there's an underlying organic brain dysfunction. Also the OAT test, you've heard me talk about the organic acid test. That's a different urine test that's done as a specialty lab. I tend to use Mosaic Lab, which used to be called Great Plains Laboratory in Kansas City, one of my favorite labs, and that is the organic acid test. That measures all kinds of markers that affect mental health, like oxalates, which affect your brain, and like neurotransmitter metabolites, not the neurotransmitters themselves, but the metabolites of neurotransmitters. Like the OAT test would also measure some neurotransmitter metabolites, like phenylmandelic acid and homovinylic acid and some others.